June is National Post-Traumatic Stress Disorder Month. Nearly 10% of people experience PTSD in their lives, and it's not always a dangerous event that can be the cause. And joining us now is clinical psychologist from the Health One Behavioral Health and Wellness Center, Dr. Anat Geva. And Doctor, thank you so much for joining us. I find it interesting. I think a lot of people might anticipate that it is some sort of dangerous event that could trigger PTSD. What are some other triggers we should look out for?
So witnessing an event that is dangerous is definitely something that can cause PTSD, but also hearing about it from loved ones or loved ones, friends, people who are close to us that we identify with that are in a risky or dangerous situation can also trigger PTSD.
What then, Doctor, would you say are some things we should then look out for, and how can we manage it?
So PTSD has a number of symptoms. One of them is the intrusion. And so we're thinking of nightmares, we think flashbacks, we think of intrusive thoughts. So doing one thing and suddenly being overwhelmed with thoughts, memories of the event, or things we heard about it, images. We think about a second criterion is avoidance. So really not wanting to have anything to do with the situation or anything that would remind us of it. We're looking for significant changes in mood and thoughts. So wanting to isolate, feeling really hopeless about the future, feeling very down. And then we think about arousal and startle, so things that make us jumpy. So say the door creaks and a person jumps, or there's a clap and they are startled. Things like that are all markers of PTSD. But to really get a diagnosis, what you want to do is get one from a professional who's trained in knowing what is normal and what should require more professional attention.
Sure, and I think that term normal is what so many people probably question is this a normal feeling? Is this normal to be like this? Is it normal to ask for help? Of course, we're always trying to erase the stigma around mental health and well-being. So it seems kind of like an obvious answer here, but why is it important, Doctor, to seek professional help when it comes to PTSD?
Well, whether or not it's normal, we know that it's very common. And it's a situation that many people experience. We're just wired to have that reaction in response to a traumatic event. Not all of us are going to develop PTSD. It takes quite a few things to fall into line, but those who do really suffer from it. Their quality of life suffers, so that distress and impairment, and our lives get smaller and smaller. And PTSD is treatable, so there's really no reason not to get that help and make our lives closer to how we want them to be.
Sure. And then what can we all do then perhaps to observe National PTSD Awareness Month?
So a lot of what we talk about that is helpful for PTSD is that sense of safety, control, and choice. So when we're dealing with someone who has PTSD, or even just one of those symptoms that I've mentioned, then making them feel safe, so not rushing them, not pushing them into a corner, giving them choices. It doesn't have to be profound choices. It could be now or later, this or that, and then letting them truly choose, have control over themselves. That relaxes our nervous system. Another thing that we can do is really be sensitive towards the things that make them startle, make them jump. And so just telling someone, stop being so jumpy, is probably not going to be helpful and actually might shame them. Now, for the people who do experience those PTSD symptoms themselves, I would really encourage you to practice saying what you need, being very clear. For example, the noise is really loud. Can we turn the TV off for that show? Or the lights are really bright. Do you mind if we dim them a little bit? Do you mind if I sit closer to the door, or if we keep the door locked or open? It's really so individual, but be very clear on what you're asking the other people to do for you. And if they don't do it for you, then look for ways of getting that sense of safety and control back into your own hands.
Sure. Some wonderful tips and a lot of great advice for ways that we can all help one another. Dr. Geva, I really appreciate it. And thank you so much for your time.
Thank you so much.
All right. We'll be right back.